My name's Brent Wilhelm. I've got over 30 years in the industry in healthcare. My role is Senior Vice President of Global Supply Chain. So my role within the Cencora supply chain is really focused on how we think about our strategy, how we make sure that we've got a supply chain to help facilitate that fast delivery of pharmaceuticals from manufacturers to the patient, making sure that we've got the right capabilities to be able to support that, particularly as we think about specialized drugs when it comes to specialty pharmaceuticals and temperature-controlled pharmaceuticals. So I do that domestically, also for our supply chain on a global scale. Specialty pharmaceuticals by name, they're special. And so the way that these are handled and treated require special shipment requirements. Most of the specialty pharmaceuticals are temperature sensitive. 70% of the new medicines being launched through this next year are in the specialty space. And majority of those, more than half of those, are going to be what we would call cold chain. So they're going to require some type of temperature packaging, whether they're 2 to 8 Celsius or colder than that. And so that requires a couple of things. One, you require packaging to be able to pack that in, but also sustain that shipment so it's viable through the transportation journey, but also storage. And so Cencora has announced over the last year that we're making $1 billion worth of investments into our supply chain, really focused on understanding that the therapy of drugs coming out require specialized handling and shipping that's different and more unique than what we've seen in the past. And so bolstering our network to be able to support that growth, both from a storage perspective of making sure we have a supply that's healthy to be able to support that demand, but also the means to ship those products and medicines to the customer. Reimbursement's definitely an issue for the dispenser, and an area that continues to be a pressure for them, and something that so politically charged that continues to be a barrier on how they think about what products they want to dispense and what products they want to carry in their practice. From a physical logistics side and operational, um, you know, what we what we've seen, and I talked a little bit about this earlier, so I'll go back to it. A real life example is that, we need to create that nimbleness in the network, and so we're thinking about where product needs to be so that we have the access to it and the logistics network to support it. One of the things that, I think the industry is really looking into is how do you, where you can how do you create more flexibility in how you move product so that you can flex to those demand requirements? I talked about AI as being something that we're looking at and should continue to look at as an industry, and how we can partner in sharing data to make sure that we've got product in the right place for treatment to be administered. But it's also where Cencora has been making some investments in how do we think about managing our inventory a little bit differently. And so the landscape of availability of product with we've had product shortages over the years. We've got geopolitical conflicts that can constrict supply. We've got diseases. Who would have thought of COVID 6 years ago? And how those impact the supply chain. And so we've thought differently about how we want to manage our network and then what that means from an inventory perspective. So we're investing in a distribution site where we're going to centralize critical inventories and medicines from a safety stock perspective. So we have inventory closest to the customer to serve the day to day, but we hold back a certain amount of inventory centrally so that we can ship that product dynamically across the country based on demand. Could be regional, could be national, to be able to make sure that we're protecting that supply and that inventory so that we're able to service those customers and they have availability of that product. So something that we're putting into the network, we expect it'll be live for us and available in 2027. We expect to see, better service levels of how we're able to manage our inventory and get that product to customers. And reduce disruptions that we see in the network.